Joining us now is House Majority Leader Steny Hoyer. Mr. Majority Leader, good morning.
Good morning, Harry. Good to be with you.
Thanks very much for taking the time to be with us. I want to go back to Jim Bunning for a second. Does he have a point? Does he have a right to stand there in the well of the Senate and say, you got to pay for this, or do you think he's out of line?
Well, under the rules, he obviously is in the Senate has the ability to do that. But I might point out that we passed what is on the Senate floor by unanimous consent, Republicans and Democrats agreeing across the board in the House of Representatives that we ought to extend this for 30 days while we try to work out the policies. Unemployment insurance and COBRA is an emergency. Under our rules, we can accept bills like this on an emergency basis. But I might also say that Senator Durbin offered to Senator Bunning the opportunity to present an amendment to the Senate to be voted on. Senator Bunning said, well, I might lose it. So Senator Bunning has simply said, I don't care what the majority wants to do. I alone am going to stop unemployment insurance and COBRA coverage, health care coverage for Americans who need it to go forward. Frankly, Harry, that's an example of why it's so difficult to pass legislation through the United States Senate.
All right, let's talk about health care for a second. Nancy Pelosi says there will be a smaller version of the health care bill that is going to be moving forward. If there is a single best selling point in it, what is it?
Well, certainly the single best selling point is what I think Senator McCain and Senator Obama both agreed upon in the debate just shortly before the election, and that was we needed to provide access to affordable health care for all Americans and all families. That is the single best selling point, because if we don't do that, the system is more expensive, less efficient, our nation is less healthy, and all Americans who have insurance are paying about $1,000 extra in their policies to accomplish that objective.
You know, it's interesting. Some of your blue dog Democrat friends say there's not enough cost containment in it. Warren Buffett, who sort of likes it kind of in principle, says there's not enough cost containment. The Republicans say let's go back to square one. Is there any chance this moves back a little bit, that there's more agreement before this thing moves forward?
Well, Harry, we're working on agreement, and as you saw last Thursday, the President convened 20 Democrats, 20 Republicans, House and Senate, to discuss it. I thought it was a very civil, positive discussion, and there were great areas of agreement. And I think that, so the answer to that question is yes. In terms of cost containment, clearly, as you know, the Congressional Budget Office says our bills save about $132 billion over the next 10 years and $1 trillion over the next 20 years. That's very substantial dollars.
Very quickly, live by the sword, die by the sword. If you get this passed, are you happy to live with this? This may cost you seats in the end come November.
Well, you know, when you go to the individual elements in our bill and ask people, do you think there ought to be extended coverage? Do you think we ought to prevent pre-existing conditions as being a debilitating, stopping you getting insurance? The public overwhelmingly answers yes. As a matter of fact, most of the things in our bill, efficiencies, extension of competition, open and transparent free markets to get your insurance, most people on the individual items say, yes, we're for that. We think that's good policy. So the answer to your question is, clearly, if we pass this bill, as I hope we will, we're prepared to go to the American public because we believe they support the individual elements in the bill.
Mr. Majority Leader, thank you very, very much for your time this morning. We do appreciate it.